Hello, everybody. It's my great pleasure to welcome you to the legislative preview for 2025, co-hosted by all three of our organizations, Colorado Center on Law and Policy, Colorado Consumer Health Initiative, and the Bell Policy Center. My name is Bruce Barnum, and I'm the Partnership Advancement Director at the Colorado Center on Law and Policy. And it is therefore fitting and proper that I get to kick this off and introduce today's session because it's all about partnership. So before we get started with our program, we are offering live simultaneous interpretation for today's event, courtesy of the Community Language Cooperative. We have Valentina with us today. What you're going to see today is three pairs of people come up, two folks from each of our three organizations, and they're going to talk about just a few things that we are going to be working on this legislative session, each of our three organizations. But really, I think the overwhelming spirit here is one of cooperation and partnership and collaboration to achieve great things in equity and economic justice for the people that we all serve. So our first pair today is our friends from the Bell Policy Center. So I'm pleased to welcome Joshua Mantell and Andrew Kuick.
All right, well, I guess I will kick this off. I'm Joshua Mantell, Director of Government Affairs with the Bell Policy Center. Want to say a big thank you to CCLP and CCHI for their leadership on this and cooperation, as Bruce put it. I'm really excited to be here and to share some of our work and knowledge with you all. And I know that the other two groups will have a robust pair of slides that they will be sharing as well. So looking forward to hearing from them as well. I'm going to kick it off really to kind of, unfortunately, Bruce called it highlights. I think this portion is going to be a little bit more of the lowlights. Because I'm going to be talking a little bit about our budget situation here in Colorado. So we're going to be in a position of cutting this year. And our understanding is that this is going to be the biggest part of the discussion at the legislature, at least until the budget is passed in April. Right now, we're looking at about a $670 million deficit. Could be up to $1 billion, depending on some factors. It was revised down, thankfully, from $1 billion was the forecast in September. And in December, they put it down to about $670 million. I think it's important to understand why we're in this place. And it's not because the economy is in bad shape. While there are a lot of people who are struggling, the macro economy on a larger level is doing just fine. We have relatively low unemployment, relatively low inflation, and yet we are in a position where we have to cut hundreds of millions of dollars from core programs just to make our balanced budget. The main reason is paper, and I don't think I can stress that enough. We have a constitutional amendment that says that we cannot spend all of the tax revenue that we collect. And in fact, we have to send a lot of it back, even if the economy is doing well. In most states, when the economy is doing well, you invest in programs so that when the economy pulls back, you can pull back a little bit. In Colorado, we don't have that luxury. And so we are going to have to be cutting because our inflation went down. That's right, our inflation went down, so we have less money that we are able to spend. It does not make a lot of sense, and yet here we are. We're also seeing the roll-off of funding from the American Relief Act, which was passed as pandemic relief from the federal government, which gave a big boost to a lot of programs that we all care about. We have also cut taxes. We cut taxes twice last year, property taxes, which directly impacts school funding. And so as a result, the state now has to put more money into schools than they otherwise would have, because local governments are collecting less in property taxes. And then finally, I want to mention Medicaid. There's been a lot of discussion at the Joint Budget Committee so far about Medicaid spending. This is a much bigger issue, and it is not an overspending issue. I want to be clear about that. This is not an overspending issue. The issue is that the federal government came in as a result of some of their pandemic relief programs and gave more money to the state to cover increased Medicare costs as a result of public health emergency. That money is leaving now, and it masked a lot of the structural issues that we have in Medicaid, which is that We have an aging population in our state that requires spending, and this is where a lot of the budgetary money goes is towards Medicaid. And so, we have a lot of people who need long-term care, direct care, low income, Coloradans who need coverage and healthcare providers. And so we have these increased Medicaid costs now, especially now that the federal government is not pitching in more of money. And frankly, we could be seeing even less of federal government money if the congressional majority does what they have said that they plan to do. And so we're looking at some rising costs, some lowered ability to spend money, and then Tabor constraining all of that in one big kind of pot. And so this is a structural multi-year issue. This is not a one-time thing. We will be cutting money now, and we will still be coming to the same problems in the future unless we do something significant around Tabor or some of our or sustainable revenue sources bringing in. Next slide. So the choices that we have in front of us are not great. We have been hearing that there will be no new funding for, so as was mentioned in a very snarky way during our quiz, there will be no new bills with fiscal notes. So we will be seeing no real programmatic funding. Cuts to existing programs are likely on the table. This does not mean even just straight cuts, as it says up there, frozen reimbursement rates. If we just keep our Medicaid reimbursement rates the same way, that is a cut in real terms, because obviously costs are still rising for everybody. Delayed funding, maybe we don't fund something this year, we fund it in next year, and then again, just cut in actual real programs. We need to cut $670 million. That cannot be just trims here and there. Those are real cuts for real people who depend on these issues. And we will likely see an end to the tax credit palooza that we've seen over the last couple of years, where we've seen a lot of tax credits. Some of them very good, by the way, including family affordability tax credit, care worker tax credit, some really important programs that were put in place. We will not be seeing a repeat of that because we do not have the money to fund those tax credits. And so I think the charge for the legislature in terms of budget is to minimize the damage and minimize the pain, especially as it relates to vulnerable populations throughout Colorado. Is that it? Oh, okay. So our charge for the legislature is to make sure they understand what it means to cut. These cuts are real programs for real people, not just spreadsheet ledgers. And so we need to be explaining on a real level what these cuts actually mean for people. What does cuts to Meals on Wheels mean? What does cuts to Medicaid reimbursement rate mean for direct care providers, for the people who depend on that direct care? And then we need to be talking seriously about structural reforms, real big picture, real ideas, so that we don't have to be coming back to this place, especially in times when our economy is actually doing well. Does that mean reforming Tabor, changing Tabor? Does that mean putting in new sustainable revenue streams so that we can be adding money into programs, fully funding things like childcare, higher ed, K-12 education, healthcare? And how do we do that in an equitable way so that we're not putting the burden on the most vulnerable and people who can afford it? So with that, I'm going to turn it over to my colleague, Andrew.
Well, thank you so much, Josh. Again, my name is Andrea Kuick. I'm the Director of Policy and Research again at the Bell. And once again, just thanks so much for being here this afternoon. So if we go to the first slide there. So I'm going to be talking a little bit about some of our predatory lending work and what we're looking at this coming legislative session. So there's going to be a lot of consumer protection work this coming legislative session. You're going to be hearing about some of that from some of the other amazing groups here that we're working with. But the thing that, again, that I'm going to be talking about is, again, around predatory lending. And whenever I talk about that, what I'm really referring to are things like payday loans or products that are similar to payday loans. These are these really high cost loans that people often are kind of forced to take out when they find themselves in some of these economically challenging times. And one of the things that we are really concerned about with these products is that they can lead to things like debt traps. And so when I talk about that is that you see people who are taking out these loans and they go to repay them, but because of these high costs and high fees and high charges and high interest rates, what they then find themselves doing is saying, well, I'm going back to pay this loan. And now I'm finding that the high charges and fees are making it so that I can't repay this loan. And so they fall further behind and further behind and further behind as they go to repay them. So payday loans are the most common types of loans that we think about with this, but we also have other types of high cost loans in Colorado, which I'll kind of get to here in just a little bit. So we'll just say I'm going to talk about two different policies we're looking at this legislative session, but I do just want to just note that we really see this as a continuation of some of the really important work that Colorado has done over the past couple years, whether that's limiting APR on high cost loans like payday loans or creating better lending alternatives. So going on to the next slide. So the very first kind of bill that I want to talk about, and this is one of the bills that we are concerned with. So this is one of the bad bills that we are very much paying attention to. So this has to do with an emerging high cost loan product that is very similar to payday loans. And you may have heard about this. They are called earned wage access, sometimes known as earned wage advance products. And essentially just what these are, again, you may have heard about them, seen them before, but what they do is someone will they'll get online, they'll go to an online app, and then people will say, well, you can go and access your wages sooner by using this app. But in doing so, you often have to pay these really high fees and these very high charges. And so what we have seen is that those outcomes are very similar to payday loans. And so when we think about payday loans, we think about those high APRs. We've capped those in Colorado at 36%. These earned wage advance and access loans can be generally about 300% APR. So again, similar product, but very high APR. We also see people taking out these loans kind of on repeat, which can cause, again, a lot of those charges. Also a lot of financial insecurity whenever we start taking a look at some of the overdraft fees that people have to continue to pay on these. So we see really challenging outcomes for people who are taking out these products. So right now in Colorado, as in most places, because this is a very new and emerging product, they're not really regulated in Colorado. They kind of exist in this gray space. So what we have heard is that the earned wage access folks are going to come in and try to say, we are not loans. Do not regulate us. Do not make it so that we have to follow transparency regulations, your APR caps, any of your different things around transparency. And so we are very concerned about that because we think that this is a step backwards for Colorado. So that's the first thing that we are very much on the lookout for. But if we go to the next slide, there are some things that we are excited about, and this is something that we're working on advancing this legislative session. And this really has to do with trying to get more data and more information about some of the high cost loans that currently exist in Colorado. So again, right now, when we think about those high cost loans, we're thinking about payday loans. We're thinking about some of those other high cost products, but some also of the new and emerging products that you might have heard about and that, again, have higher APRs. So for example, things like rent-to-own products, again, some of those earned wage access products that I had just mentioned. So again, a lot of these products right now are currently regulated in the state, but we don't have a lot of information right now as to how many people are taking out these loans, what those APRs look like for people who do take those out, as well as the outcomes for individuals as far as your bankruptcies, your delinquencies, et cetera. So what we would really like to do with this is to say, well, if you're going to be operating in the state, then you just need to fill out a form that tells us and tells the Attorney General's office, how many loans are you giving out? What again are those APRs? What again are those outcomes? And we think that this is really important because, and again, in addition to reporting that information and collecting it, it would then be made public as far as in an aggregated form. And so this would give the state and a number of advocates just an opportunity to say, this is what's happening in Colorado. Can we make policies that are responsive and work for people within the state? So that's what we're looking at. It's a data collection, a data transparency bill. The very final thing that I would just end on here, and I think that this is often the same for a number of policies that we're looking at, is we see this as really important, especially this year, because some of the data that we have been collecting and relying upon for the past several years has really come from the federal government. And so as we see rollbacks at potentially the federal level and how that data is being collected with the new administration, this becomes really important for the state of Colorado, again, to do more. So with that, we're always happy to take questions at the end. But with that, I think we'll pass it over to our friends from CCLP.
Hello, everyone. Thank you all again for being here. My name is Morgan Turner. I'm the Community Engagement Director, and I use she, her pronouns. And if you're wondering, did Ani and I plan our outfits? We did. But really happy to be here and really looking forward to sharing about a few of CCLP's priority bills this year. So the first bill that I'm going to talk about is the Necessary Documents Program, informally often referred to as the ID bill. Some of you may actually remember this from last year. We partnered with partners, including Colorado Coalition for the Homeless, Homeward Alliance, and Colorado Blueprint to End Hunger. Unfortunately, due to a variety of different reasons, that bill was actually postponed indefinitely last year. So we're bringing it back this session. And so to provide a little bit of context about the Necessary Documents Program, this program already exists. It initially was passed in 2021, and essentially it pays for free vouchers for identification documents for individual people. So that includes residents who are victims of domestic violence, impacted by natural disasters, seniors, low-income folks, disabled folks, and people experiencing homelessness. So a lot of our sort of priority populations really fall into the eligibility criteria for this program. Great, right? Amazing that those vouchers are available. They're free of cost. Unfortunately, the program as it stands now has a variety of different administrative challenges. So it's a complicated program structure. Voucher transfers are often delayed. Vouchers only stay valid for 30 days. So this is really resulting in a low utilization rate. I think it's about 30% utilization rate. And I like to think about, if I'm a person experiencing homelessness, for example, having to receive the voucher, keep it with me, make my way to, a motor vehicle unit or, building, all the things that can go wrong, and often do go wrong just in life in order to receive a valid driver's license or state identity card. So essentially what we are putting forward is the proposed bill will remove the need for physical vouchers, which will allow eligible people to access ID documents at point of service. So nothing will change in terms of the eligibility criteria. That will stay the same, but we are hoping to remove the need for that physical voucher. And the next bill that we're going to be focusing on this year in partnership with Spring Institute, as well as we're working closely with the governor's office, as well as Office of New Americans, is focused on language access within state agencies. So many of you may know or may not know, but as of 2022, 300,000 Coloradans have limited English proficiency. That accounts for about 5% of our state. And it's really critical for state agencies to provide language access for a variety of different things and or reasons in order to advance equitable delivery of public services, information, programs. I truly believe that, our state cannot function to its completeness or in the most equitable way if folks don't have access to information in their preferred language. So this bill, and I will say, I will preface, we are still, I think, ironing out or really focusing in on some of the details. But what we are hoping for as of now is to create a preliminary working group that will launch a internal survey of what the sort of current language access challenges, barriers, what the needs are within state departments. We do have some great buy-in from the governor's office as well as Office of New Americans, and we have a $100,000 placeholder in the governor's budget. So there is some funding to sort of back this effort. This will be one of many year-long, right, process in order to get to the place where we can say that there truly is language access throughout, the entire state, and specifically looking at state agencies. So after this preliminary working group, sort of the next step of that will be to establish a formal working group that will oversee the survey results, and then also the implementation of the policy for language access. So the ultimate goal of this, as of now, is to develop a statewide language access policy that would have to be implemented by state agencies. And throughout this process, both the sponsors, Office of New Americans, I think one thing that we've been really trying to emphasize is the need for community engagement, community outreach during this entire process. So we're really trying to build that in within the timeline of, surveys, from development of the policy framework, making sure there's ample time for community to actually weigh in on the proposed policies. Thanks. And I'm going to pass it over to Ani.
Hi, everyone. Good evening. Ani Martinez. I am the litigation director at CCLP. They took me out of the courtroom to present here with you all today and everyone online. Happy to be here. For our Spanish speakers, estoy muy orgullosa de estar aquí con ustedes. I'm just super excited about it. And next slide. So the first one I'm going to talk about is an actual bill. The next thing I'll talk about is more of a vibe and a worry. So the Labor Peace Act modernization is really what we're talking about here is the fact that Colorado's labor laws require a second vote for union security or for what we call an all-union agreement. That is not really in line with the National Labor Relations Act and not really what you see in a lot of other states. So that's kind of the modernization part of the title there, is getting Colorado up to what other states are doing and really what the act recommends and prescribes. So what that would do is it would remove the requirement for a second election, therefore making it easier for workers to organize, as well as eliminating a concept called free riding, where individuals are receiving the benefit without having to become union members. So, slow down, sorry. I didn't need to tell you all to slow down. I'm telling myself to slow down. So that is the first bill, or the only bill I'm talking about. Let me see if there's anything I need to cover again. So we would need 75% of voting members to approve, or 50% of all eligible to be able to include such agreements. And this would really, as we know, I think most people in the room, virtually and in person, know that when we have strong union representation and membership, that really is a rising tide kind of thing for all workers across the state. It helps with conditions in workplaces as well as wages. And so this is something that is not only important for individuals who work in areas that have the opportunity to unionize, but those benefits really do. It's one of the few times things actually trickle down. The next one is what I call the vibe, because while there is not necessarily a bill being proposed to strengthen Medicaid, what we really wanted to cover here that our partners covered earlier, but a little bit more in depth, is how we really need to consider how we defend Medicaid going forward. With this giant budget gap, Medicaid is truly under some really intense scrutiny. It was, I think, even one of the participatory questions in the beginning of what do we think will get cut or impacted is reimbursement rates, right? So the concern here is that Colorado was already facing some inadequate funding. And then we've had a faulty eligibility system. Technology is not where it needs to be to even get people enrolled. And then the PHE unwind in this state has been one of the worst in the nation. So we've got that problem. In addition to that, clinics are really in turmoil right now. There are large numbers of uninsured patients that they are not turning away. But clearly, if they're uninsured, they're not getting compensated for that care. And so they're putting a larger stress on some of our clinics, including federally qualified health centers and a lot of the spaces where the most vulnerable of us get our health care. Because of that, we've seen large amounts of staff layoffs in some of these clinics, as well as shuttering down of programs that are really necessary and vital for the health of the community. So the vibe check for the room is that we really want to share with everyone that there is an immense priority that we need to share to defend Medicaid and other public benefits nationally and in Colorado. And this is really important because it's for our well-being, right? A healthy person, a healthy populace is a healthy state. And that means that individuals can engage in society, they can work if they want to work. Some of the statistics that we have actually shows that in 2021, most adults receiving Medicaid who didn't have a barrier to work were actually working. So to be able to not only be healthy as a person, but as an economy, we need to be defending programs that support the most vulnerable amongst us, and Medicaid is really one of those. And so what we want to share with the room virtually and in person is that this means as coalitions, we will be working together to sustain state funding for public programs through budget advocacy.
Thanks everybody for joining us this afternoon and evening. My name is Adam Fox. I'm the Deputy Director at the Colorado Consumer Health Initiative. I use he, him, elle pronouns. And I just want to sort of re-emphasize what our colleagues at the Bell Policy Center and CCLP have said about defending Medicaid. And that's something that we are going to be prioritizing as well and working in collaboration with many organizations to really ensure that Coloradans continue to have access to the health care that they need. And that will include also, I think, unfortunately, a fair amount of federal defensive work that we are preparing for as well. Next slide. But let's talk about some more positive things on the healthcare front. So we know that mental health parity laws have passed at the state and federal levels, but in reality, they are not really functioning to ensure that people have parity in access to mental, behavioral, and substance use treatment. And so some of our friends and colleagues at Healthier Colorado and Inseparable are going to be bringing a bill, and this is going to be run by Representative Brown, that will really try to codify a little bit more precisely how we can implement mental health parity. And in particular, this is going to look at how the insurers have to follow a definition of medical necessity that is actually endorsed by the medical professionals and community who are actually providing this kind of treatment. So this is going to be an important additional protection to the mental health parity laws that we already have at the state and federal levels. And I think it's hopefully going to make it easier for folks with state regulated insurance plans to ensure that they get the mental health and behavioral health services that they may need. I do want to call out, I mentioned very specifically state-regulated insurance plans. We'll talk a little bit more about that related to another bill, but we can't regulate the insurance products that are covered under federal law or self-funded plans that provide a lot of employer insurance. Next slide. The next bill that I want to talk about is really about sort of protecting our provider workforce. In 2022, there was legislation that eliminated what are commonly known as non-compete clauses for lower wage workers in the healthcare space, but higher paid healthcare providers were exempted from that legislation. And so that really excluded most physicians, nurse practitioners, dentists, and a number of other healthcare providers. Even though there's a lot of indication that non-compete clauses are unenforceable in our state, they are still being included into contracts with providers from healthcare facilities and creating a lot of fear and challenges for our healthcare provider community to be able to practice where and when they want to in their profession. And so this bill will look at banning those non-compete clauses and what are also called restrictive covenants to ensure that our providers can move around the state as they need to or want to provide care to our friends and neighbors. Next slide. And one of our perennial issues for CCHI, unfortunately, has been surprise ground ambulance bills. So these are out-of-network bills that people get when they are picked up by an ambulance for one reason or another, or they are transferred between facilities, and that ambulance may be out of network. We were able to pass some limited protections in the 2019 bill that we worked very hard to create and really establish out-of-network or billing protections for patients, but it left out public ambulance entities, which is a significant chunk of them. And it also did not address what happens when a patient is transferred between facilities, because that is often coded as non-emergency, even though the patient has no choice in the matter. So this bill, which was brought last year and unfortunately died, is coming back in a little bit of a tweaked format and will hopefully get across the line to really address all of the out-of-network ground ambulance bills that we are able to at the state level. This is one of those other issues where we can't address the insurance plans that are federally regulated or self-funded. But we want to make sure that we are providing the maximum protection that we can at the state level while we continue to work with our congressional delegation to augment the No Surprises Act to include these protections for all of those federally regulated plans as well. And I'll pass it to Isabel.
Thank you. Hi, everyone. For those of you I don't know, I'm Isabel Cruz. I use she, hers, they, yeah pronouns, and I'm honored to be the policy director here at CCHI. I'm really excited to have this opportunity to talk through all of the different but interconnected policy areas that the three of our organizations and so many of those represented in the room work on. And so I'm going to kind of close out our section with three additional areas that we are working on at CCHI. So I had hoped to have more details on this slide, but I will just give you a suspenseful teaser on something we're working on instead. As Ani was talking about in CCLP's presentation, we know that healthcare right now, as it has been for a long time, and it continues to worsen, is a tale of two cities, right? We have our safety net clinics struggling, particularly in the wake of the healthcare, of the public health emergency unwind. And we know that Coloradans and folks across the nation are facing increased barriers due to cost and other factors of accessing care. And then on the other side, we know that particularly our front range large hospital systems are continue to make a very significant amount of money. And we know that in the commercial market, our hospitals on average are charging commercial patients almost 300% of what Medicare would pay for a service. And we know that these issues are interconnected because funds are going into our healthcare system and they're not being used equitably to ensure all Coloradans and all people have equitable access to high quality, affordable healthcare. And so there will be work this session to address both of these in one fell swoop in one small but significant way. And so I'm looking forward for you all to have more of that information in the coming weeks. So stay on your toes. Yes. So our next priority comes from our community advisory board. So if you haven't been following our awesome CAB, it's a group of folks from across the state who have been learning about advocacy and how policy is made, and has been using their personal, professional, and community experience to identify solutions to improve our healthcare system. And so a priority that they have identified is care coordination, right? Particularly for folks who see a lot of providers across different systems. How you interact with your health data is a big issue for people that I think a lot of us can identify with. And so connected to care coordination is an arena that I have been learning more than I ever thought about, which is health data privacy. In a way that should be pretty straightforward, but is not, you would think that, right, patients should have as much access and as much of a right to their own healthcare data as the providers who use it, and as the companies who collect it through their proprietary means. But that's not the case in our current system. And as telehealth and other electronic means of accessing healthcare are growing, particularly after the pandemic, this is going to continue to be a challenge. And with some of the federal changes that could be coming in some of what was proposed in Project 2025, there are concerns around data privacy, particularly in reproductive health care, but in general. And so we also know that our healthcare data are incredibly profitable. They're worth 5 to 10 times as much as other types of data. And so we are working with our community advisory board to develop policy on creating some minimum standards for consent language in how people put their data into the system, making it easier for people to get their data out of the system and control who has access to it, and ensure that there are better privacy standards there. So we will be working on that, and stay tuned. And finally, thank you. Many of you all might have seen on your ballots Amendment 79, and CCHI took a support position, was very excited to see that pass. So Amendment 79 enshrine the right to abortion, when we know abortion and reproductive healthcare is healthcare, right? So we enshrined that in our Constitution, and eliminated the ban on using state funds to cover abortion, which really impacted Medicaid patients and impacted folks who are a state employee health plan, right? Our nurses, CDOT workers, so many people, right? And so since that passed, as anybody who has worked on policy in the room, when a ballot initiative passes, there's always another step to make it a reality, right? So led by the same folks who worked to make sure that Amendment 79 got across the finish line, the Colorado Organization for Latina Opportunity and Reproductive Rights, COLOR, and COBALT are leading work to ensure that this work, the Amendment 79 is integrated into statute as it needs to be. So they'll be striking all reference to the state funding ban to ensure that abortion care is covered where it needs to be, explicitly requiring, yes, I know, right? Which is ironic. Explicitly requiring that the Office of Healthcare Policy and Financing, HCPF, covers abortion care and abortion and miscarriage management for our Medicaid patients through the suite of insurance public insurance that they manage, and ensuring that state employee health insurance plans cover both abortion care and miscarriage management. So this will be an important means of ensuring that there are fewer financial barriers based on insurance type for folks to access the reproductive health care that they need. And so with that, I will turn over to questions and answers. Thanks for having us.
Wow, wonderful presentations. Thank you so much. So next we're going to move on to Q&A. Our CEO, Lydia McCoy, is going to facilitate that part of the question. So with that, let me welcome Lydia, and we'll get the questions and answers started.
Thanks, Bruce. And so happy to be here with all of you. I think it's really clear why we did a joint event because of the partnership we have between our three organizations, and none of us can do this alone. That's very obvious to me. Are there any, we have some online. Is there anyone burning in the room before we start going through some online questions? Yeah.
Hi, I'm Elizabeth Batiste. Thank you so much for presenting all of that. I guess I have an overall general question about the approach to any legislation that has fiscal notes or any creative tactics that may help you avoid them. I think some of these, may be able to be approached in a way that would avoid them, even if it might be good for them to go through some sort of like rulemaking process or have some type of appropriation. So it's not specifically for anybody, but I'm just curious what the policy experts are thinking through in terms of those tactics to improve the likelihood of success without incurring additional costs.
Thanks for that. I'm going to nominate Krista Kennedy to answer that first.
Thank you, Lydia. I think it's really tricky. I mean, I think that step one is try to figure out how to eliminate the cost from what you're trying to do. But I think part of this, I think people don't really realize how much flexibility there actually is in these fiscal notes. And that's not always the case. There are times where there's something really concrete that drives a cost. But there are other times where there's a little bit of discretion that could the department do this with the staffing that they already have? And that has everything to do with whether the governor supports what you're trying to do. So I would say bend over backwards to cultivate support with the governor, work closely with the departments, get them drafts before you introduce the bill. If you have a concept that you're working on, if you put it on bill paper and it gets sent out to the departments for their fiscal notes, some of them may be seeing it for the first time and they may react by slapping a pretty big fiscal note on it because they don't really understand what's going on. So I'd say if you can have those meetings with the departments in advance and say, we really want to make this happen. We'd like your feedback on how we can do this in a way that does not drive a cost for your department. You may be able to solve some of these problems on the front end. And I'll also say this. I mean, I think that it's true that it's very unlikely that bills with large fiscal notes will pass, but you never say never. I mean, there's always going to be something that becomes a high priority for whatever reason that may make it. So then that's one of those places where the strength of your coalition, the breadth of your support within the chamber, especially if it's bipartisan, can make a big difference.
Thanks for that, Chris. Thomas.
Thomas Davidson, he, him pronouns. I'm curious if any of the three organizations have an opinion on the governor's proposal to privatize Pinnacle, the state workers' compensation program, and what you're watching for, if you whether you like it or don't.
Yeah, thanks for that. Who would like to tackle it? And whoever does, would you please come to this area so the people online can see you? Yeah, Pinnacle privatization. Anybody? Chris, get on up here.
Short straw. For those of you who don't know, the reason I'm getting called on is I'm a former a current state legislator until tomorrow, and then I become a former state legislator. This is an issue that's been coming up for a long time. I think when I was a legislative aide in 2010, there was a proposal to privatize Pinnacle. I think for those of you who don't know, Pinnacle is the workers' comp insurance of last resort. It's essentially a safety net system of sorts to make sure that if you're not getting the coverage for the things you need, there's like a more heavily and tightly regulated insurance plan. I think there are deep concerns about privatizing Pinnacle and what it would mean for workers and what it would mean for people who rely on this safety net system that don't trust that a private company would be able to offer the same kind of security and the benefits. I don't really claim a deep expertise on workers' comp policy, but I will say that there are just a lot of concerns out there that if you move away from a public, heavily regulated system to something that is a little bit more part of the free market, that you're going to see benefits get cut, you're going to see risks to workers getting what they need.
Thanks, Chris. We're going to go to a couple of questions that came in from online. But if you're in the room and you have a question, just get Lydia's attention and she'll put you in the queue. Ooh, maybe I'm sitting a little too close to something. The first question was, I can't join for the entire presentation due to family obligations. Will the event be recorded? And yes, it is being recorded right now. So we will be able to post the recording online shortly. I think all three of our organizations will post it in one form or another. So check out our websites. Definitely sign up for the newsletters of all three organizations. Follow our social media channels, and you'll be the first to know when that recording is posted. Next question. Medicaid has many expenditure areas. Is the excessive expenditure in long-term care more recipients from the pandemic? Or, basically, is it explained by having more recipients from the pandemic or what? What areas? Maybe a good Bethany question. Yeah.
Yeah, I'll take that. Yeah, I'm Bethany Prey. I'm the Chief Legal and Policy Officer at CCLP. I use she, her pronouns. I think it's not correct that there's excessive spending for LTSS populations. I was looking recently at national data on our per member per month spending. We are somewhat on the higher end of the scale for our LTSS population, long-term services and supports, people with disabilities. But overall, we ranked in the most recent data 40th nationally in our per member per month spending on Medicaid. In terms of the share of our state budget, we're 4th, I believe, compared to other states. But that's a reflection of our budget. It's not a reflection on our Medicaid spending. So, although there's been a lot of discussion at the Joint Budget Committee about why are costs so high. Costs are so high really because of hospital systems and the way our healthcare system makes profit, and the fact that we have a lot of for-profit or sort of quasi for-profit nonprofits that charge a lot for healthcare services. So the solutions to this are very complicated and are very long-term. But my wish is that we find ways to fund the things that we need to fund. And that doesn't mean making cuts to provider rates or making cuts to SNAP administration or SNAP outreach. It means using Tabor in whatever ways we can currently, enterprises or whatever else, and being creative about doing that while we figure out how to make our budget have the flexibility that it needs.
Thanks, Bethany. Next question we have is, what percentage of the deficit is due to Tabor? Or I imagine if we don't know the exact percentage, maybe just talk about how that causes the deficit. Who would like to take that one? Josh is looking ready. We're going to go to Josh.
What percentage of the deficit is due to Tabor? That's a hard question to answer. I would just say that we have enough tax revenue to cover the ongoing needs as we currently fund them. Now we need much more revenue to actually adequately fund the things that we know we need to adequately fund, and that's another part of this discussion. But the thing about Tabor is it artificially limits the amount of money we're allowed to spend, and it uses a formula that is not tied to anything that we actually do as a government. So when we use inflation as a part of the component to determine the cap on our spending, government doesn't spend money like a household spends money, right? Government isn't spending money on eggs and bananas and milk. Government spending money on healthcare. Healthcare costs are rising significantly more than any kind of inflation. If our inflation was rising like healthcare costs are rising, we would have had a revolution a long time ago. And so the idea that inflation is the proper way to determine how we spend money is a misnomer. And that goes as much for population as well. We don't spend the same kind of government money on every single member of the population. We spend a lot of money on very, very young children, and we spend a lot of money on older adults. People in kind of the prime age, working age, government doesn't spend a lot of money on them, but we count everybody the exact same way in this kind of formula. And that's why these kinds of formulas should not be in our Constitution. having these formulas constitutionally mandated prevents us from doing the things that we know. We know we spend more money on kids, and we know we spend more money on older adults, but the Constitution, as it's currently constructed, doesn't care about that. It's the same thing with inflation. And so that's why Tabor is so out of date and in so need of some real reform and some real changes in order for us to be able to spend the money that we know we need to spend in order to provide the services that Coloradans need and care about.
Any other questions in the room right now?
All right, we're going to take a question in the room.
Hi, my name is Molly. I use she, they pronouns. I'm wondering if there are any amendments or changes coming up to the hospital discounted care bill that you guys could talk about.
Hospital discounted care. Adam?
I will just say we sure hope not. And at least at the moment, we haven't heard rumblings along those lines. We did a lot of work, especially CCLP and CCHI last session, to find a bit of a compromise with the hospitals without really affecting the hospital discounted care program for the vast majority of folks, and really making very minor adjustments. And so our hope is that that's sort of the end of the conversation. I think the other thing that I would highlight is CCHI just put out a report this fall about how poorly the hospitals are doing in actually providing hospital discounted care. If you call them for their financial assistance line or try to get the application or information about hospital discounted care, a lot of times you can't even get a person on the phone to answer the question, much less get through the process. And so that will hopefully give them a little bit of pause of going after it, because we can show they're not doing a good job as it is.
So we're not going to be able to get to all of them. So I'm gonna do the ones that were anonymous, so we make sure we get those answered, because we don't know who put that in the in to be answered. And then for folks that we have your name that you asked a really good question, we'll send those around to the group of panelists, and we'll see if we can get you an answer in one form or another after the event. So for those ones that are anonymous, one asked, I'm unsure how HCPA for Education communicates where to cut rather than the JBC saying, let's cut XYZ. How does this process work? How do they decide in those departments where to make the cuts, which I think is a really good technical question about that process. Who would like to speak to that? Bethany again. Everybody's looking to Bethany.
Well, I'll say, Bethany, pray again, that my understanding, and I would be love to be corrected, so folks can step up and correct me. There's a conversation between the governor's office and the different departments about what the recommended cuts or changes will be in the coming year. And there's a lot of debate at the Joint Budget Committee about what makes sense, what doesn't make sense. There's an opportunity for stakeholders to weigh in by talking with Joint Budget Committee members, by maybe talking with the analyst, the budget analysts. So it's a, as many people say, the governor's budget is a draft that has been put together with consultation with the departments. But then after that, there will be a lot more input from the budget committee members and stakeholders to come up with subsequent drafts. And then also there'll be a new budget estimate that comes up later in the session, and that will also affect outcomes.
I don't have anything to correct, but I did want to just add something. So there is an opportunity for public engagement that is very underutilized, which is called the Joint Rule 25 hearings. So every year after they kind of get through the budget proposal, like all the work that the JBC is doing, the Joint Budget Committee members go before the joint committees of the House and the Senate on every different topic. So they'll have both the House and Senate health committees take a hearing where they hear from the Joint Budget Committee members, and then there is public comment. They do the same thing with the education committees. This is something where the public hardly ever shows up. And to be fair, you have to kind of know it's coming to look it up on the website. But for folks that are following the Medicaid budget and have an opinion about this, you should cut this and not that, or folks that are following the education budget and are saying, here's how you should go about implementing the new school finance formula and what kinds of cuts we think are going to be least painful. These are great opportunities to show up and influence the budget process.
Okay, we're going to do 3 more questions. One that I think we have a quick answer to, and then one more anonymous one, and then we're going to wrap. So start thinking about that answer. So the first one, Judy asked, does the necessary documents bill include people coming out of prison with no IDs? And from the fact sheet we have on there, the Colorado Necessary Documents Program does not refer to the state ID program through the Department of Corrections. Does that cover it? Char, do you want to? Start sitting right here, just briefly.
Well, in my cohort, and Andrew West from CCH on the bill is also here. But the Department of Corrections has its own ID program. It started about the time ours did, actually before 2021. But they recognized there was a problem with releasing people without any valid ID. And so they have sort of a whole separate program that works with people coming out of the state institutions.
Great. Thank you so much for clarifying that one. All right. So then our last anonymous question, so we make sure we handle that. So Isabel mentioned Project 2025. So the question is, how are the plans of this new governing body going to impact this state and community, specifically punishing groups that you've been speaking about? Won't the State General Assembly be hampered in protecting vulnerable people?
Yes.
I mean, yes, I think the answer is definitely yes. Does anybody want to expand on that a little bit or talk about what we know in our response to that? I don't know where Isabel went. All right.
I'll take an initial stab. I think it's pretty clear that there's going to be a lot of activities that are focused, that are anti-immigrant, and we've done a lot in our state to try to expand public services in general and healthcare to folks regardless of their documentation status. I will say that one of the things that we're keeping a close eye on from CCHI's side is what the Trump administration decides to do with what's called our 1332 waiver, which allows us to capture savings that we have accrued through a variety of programs at the state level and reinvest them in health insurance affordability programs. And I think there's a real risk that the Trump administration plays games with our 1332 waiver or how much money they decide to give Colorado as sort of our savings calculation. So I think there's the potential for additional legislation, frankly, at the state level to respond to some of those kinds of threats. I think we've done a lot at the state level to insulate ourselves to a large extent as much as we can. But the reality is, if the federal government goes after people in our communities, some of those laws may not be sufficient. And where the state and federal laws start to conflict, it's going to create a lot of confusion, uncertainty, fear, and ultimately harm.
Thank you so much. I think that was a great answer. All right, we're going to take our last question, then we're going to wrap up so we can let everybody online get on with your evening. But again, we have over 20 questions that have come in here, so we will follow up with you with some answers. I'm thinking out loud, maybe we'll put together a Q&A document that we can put with the event recording when we publish it or something like that. But there's a lot of great questions we didn't have time for. But we really appreciate everybody attending in person or online and giving us those great questions. They all deserve some response. We'll make sure we get one. Sorry, a little mic trouble here. But that last question, how do you propose or see Tabor being reformed? Now, Tabor has been mentioned a number of times already tonight. It's clearly top of mind for all 3 of our organizations. And who is going to take on Tabor reform? So I think really to be able to speak about, who's in the fight to change Tabor and make reforms What does that look like? What's happening on that front? Who would like to take that on? Oh, there we go. Joshua's ready. All right, send us off. And good style here, Joshua.
Yeah, and I'm sure other people have thoughts on this. I think there's a lot that can be done around Tabor. Frankly, having a 30-year-old constitutional amendment that has not changed, I think there's a real appetite amongst Coloradans, especially those who may not either have voted or were in Colorado in 1992, to really revisit the things that are not working. I think foremost on the Bell Policy Center's mind is just the basic need for more revenue and revenue that comes in a more equitable way. And so that means making sure that the wealthiest among us are paying their fair share of taxes that can then be put into programs and policies that we know work and help all Coloradans. Most people don't know, Tabor actually prohibits any kind of graduated income tax in Colorado. We have to have a flat tax per our Constitution. That does not make any sense. We need to have a way so that we can ensure that the wealthy are paying their fair share, so that we have the revenue able to adequately fund all of our programs. So that's the first thing that I think is easy. It is not easy. It's doable and it's out there, and we can make it happen. And I do think you will see some work over the next 2 years to make sure that that is in front of the voters of Colorado. Longer term, I know that there are a lot of groups thinking and working about how to reform or completely change Tabor's hold on our state budget and the way that we actually govern in our state. As I mentioned before, it makes no sense that we have a good economy and we are cutting from our budget. It makes no sense that when our inflation goes down, the amount of money we are allowed to spend goes down. That is by no means good governance, and no budget writer in any earth reality would ever prescribe this. And so I think there's going to be work over the longer term doing that. That's going to take education. That's going to take some real hard messaging and narrative building. But I think that is on the docket. And I think over the next few years, you will see that. Lydia.
Thanks so much, Josh. Appreciate that. And yeah, great question to send us off into the next iteration of some of the heavy lifts we have to do in the coming years. I'd call out another partner who's not here with us today, but Colorado Fiscal Institute is playing a real lead role on this Tabor fight. And so lots more to come, but it's not going to happen quickly. Thank you all so much for being here. And I hope for those of you who are in the room, you stick around. We have drinks, we have food. It's a lovely night to stay with the people that you like, right? And spend some good quality time. If you have questions, if you're in the room that you didn't get answered, we're all sticking around. So feel free to come up to any of us and have a conversation. For those of you online, thank you so much for Zooming in, and we'll get the answers to those questions to you as quickly as we can. Have a great night, everyone. Thank you.